affect small numbers individually but impact more than 300 million people globally across 7,000 conditions, most beginning in childhood. Our patients often face delayed diagnosis and limited access to care. Ahead of Rare Disease Day on the 28th of February, Sanofi South Africa reaffirms its commitment to improving outcomes through research, better access to treatment and policy engagement. Ongoing efforts include participation in global registries such as the Global Gaucher Registry to strengthen evidence and patient care. And to discuss this further, we are joined on the line by Monique Nel, a medical advisor for rare diseases at Sanofi South Africa. Monique, good afternoon, and thank you for joining us on Africa Update.
Good afternoon, Lulu. Thank you for having me.
Now, Monique, in a country where our health system is already stretched thin dealing with HIV, TB and NCDs, rare diseases often fall off the radar entirely. When we say more than you can imagine, what is it that South Africans don't see or know about rare diseases, patients living among us?
Thank you, Lula. So just maybe for our listeners, the more than you can imagine is the theme for this year's Rare Disease celebration. So in South Africa, rare disease patients are living among us. They're not that rare at all, but the reality is largely unseen of what these patients are going through. We don't see the diagnostic odyssey. So diagnostic odyssey is that first sign or symptom of your disease or your condition up until the time of diagnosis. And that can take multiple years. We're talking about 5, 10, 12 years to reach a diagnosis. And during that time, it will be multiple doctors' visits, repeated tests. Sometimes these patients are misdiagnosed and treated wrongly. So being told maybe to wait or to watch or even just to come back next week. So the journey is much longer than we could ever imagine. We don't see the resilience sometimes it takes to keep pushing and to fight for answers. And the last thing maybe just to mention on this question is the financial strain. There's travel costs, there's time off work, the out-of-pocket expenses. So while trying to care for someone with a very complex lifelong condition, there's a lot of things that we have to keep in mind when we think about these patients. It's more than we can imagine is what they're going through. But at the end of the day, they are resilient, they are persistent, and we want to celebrate those patients for being there for their family members and just going through this entire process. We want to be there for them.
Why does diagnosis take so long?
Good question. It takes so long because rare diseases are not top of mind. I mean, they mimic so many more other common conditions. So patients are treated for individual symptoms. They are not treated for the underlying cause. They're being treated for pain, for fatigue, for delayed growth, or even the single organ problems, without having the bigger picture in mind. So the doctor doesn't have the ability to connect all the puzzle pieces. So awareness remains a big gap. Education has to improve. We still have a very long way to go.
You know, Monique, most times you'll find if you're feeling ill, you go to the doctor, the GP, and the GP will ask you how you're feeling and then make a diagnosis on that in terms of, okay, this is what I think you have and this is the medication that you need to take. And to get to a specialist of whether it's ENT or a cardio or, pulmonologist and so on, you have to go through the GP. Is there a way of bypassing the GP and going directly to a specialist where maybe there could be a difference in terms of time wasted?
So I think we also have a dual healthcare system. So maybe in the private sector, it might be easier to consult with a specialist easier. Whereas within the public sector, you have to follow the system, and the system is not really designed for a rare disease patient in mind. So the referral pathways are not as simple, and navigating through the healthcare system can really be overwhelming for our patients. So I think private sector might be more easier to get to a specialist, But in the public sector, it is following that unnecessary process is to get to the specialist that could potentially help you with a diagnosis and then manage your disease better.
And thus, I guess, the issue of equity in healthcare, when does it become balanced, and when the system is under huge pressure and resources are limited, how do we even begin to talk about equitable access for rare disease patients?
Sometimes I think we've got a misunderstanding about equity. It's not always about resources, because it doesn't always have to be equal spending. It means a fair opportunity to everyone to be diagnosed and to be treated appropriately. Even in a resource-constrained system, it must start with the essentials, with the basics, the fundamentals, just having awareness, just being recognized, just have a clear pathway to a clinician that has the expertise, and making sure these patients are not lost in the system just because they've got a rare or a condition that is difficult to manage or to be diagnosed. So equity means for me more visibility, to be counted, to be recognized, to have a plan for these patients for the future, to open up access to diagnostics, to open up access to treatment that's already approved and available in the country.
And what are the practical, achievable steps that can be taken right now to improve the lives of rare disease patients, even with the limited resources?
I actually want to start with our policy leaders. I think this is where it needs to start, because a lot of groundwork is being done by patients and patient advocacy groups and healthcare and practitioners. But I think our call to action now is from the Minister of Health, who has acknowledged rare diseases and should now have the opportunity actually to translate that commitment that is made into practical implementations. So that means including rare disease in the planning framework, including it in the strategic discussions, and including data collection when we look at rare diseases, to ensuring that they are visible at the national health discussions. From there on, I think, the other things becomes a lot more achievable and could be immediately implemented, like strengthening awareness and education so that healthcare professionals can recognize these patients much earlier, simplifying the referral pathways, as we've already now mentioned, and importantly, just improving the collaboration across the ecosystem. We need public and private sectors, laboratories, specialists, and patient advocacy groups just to stand together. We cannot work in silos. This problem is too big to work in silos. So these are the practical steps. I do believe they are realistic, and together they can significantly improve the lives of patients.
Monique, thank you for your time on Africa Update.
Thanks, Lulu. Bye.
Bye. That's Monique Nel, medical advisor for rare diseases at Sanofi South Africa, joining us on the line.